Hello, once again, I welcome you back to the Nursing Moms YouTube channel. I'm Nurse Janet, and in today's video, we want to talk about twin pregnancy symptoms. Why would you suspect that maybe you are having twins before going for that ultrasound? I'll be talking as a mother of twins, what I experienced, and again, as a nurse, most importantly, as a nurse, what I can tell if a mother comes to me that I'm feeling this and that. And probably I'd advise you to go and confirm your doubts with an ultrasound. Watch to the end. These symptoms are based on what I experienced as a mother of twins during my twin pregnancy and most importantly before I went for an ultrasound. These are the things that triggered me to go and confirm whether I was having twins or not. The first symptom of a twin pregnancy is extreme morning sickness. Actually, morning sickness is something that is common in almost all pregnancies, but with twin pregnancy, due to the high levels of HCG hormone, there is that extreme morning sickness that, okay, if at all it was your subsequent pregnancy, like it was in my case, I realized that this was a bit different from the previous pregnancy that I had. The morning sickness is also extreme that you can find yourself sleeping the whole day, you don't want to eat, you are moody. The vomiting is extreme and another level. The reason behind this is just due to the elevated levels of HCG hormone. This hormone in single pregnancy, it works in maintaining the pregnancy. But again, remember in this you are having two babies. Most likely it's supposed to be on a high level to maintain this specific pregnancy. So if you are experiencing extreme morning sickness, it's not a diagnostic way, but it can be a sign of having twin pregnancy. The second symptom is high levels of HCG hormone. HCG hormone is the hormone that is released during pregnancy to maintain pregnancy and is excreted in urine. It's the same hormone that when doing home pregnancy test, it's what you test in the urine. Yeah. So during singleton pregnancy, like in one baby pregnancy, this hormone is always within the normal range. But if it is more than one baby, the hormone levels becomes above normal. The levels are high because you are carrying more than one baby. The way that you can know this level of hormone is high is through blood test. But again, in my case, I did home pregnancy test and it was about 10 to 11 days post the date that I was supposed to get my menses. And to my surprise, the strip turned dark immediately. And I was surprised, okay, what? I didn't know, it didn't hit me like maybe it's a twin pregnancy. But again, different from these other pregnancies that we do check that the strips one line can be faint or the lines can be fainter, like in the 10 to 12 days post the date that you're going to get your menses. It was different that it was instantly dark tone lines. This shows that the hormone level, the HCG levels were high in the blood already. The third symptom is extreme fatigue and exhaustion. Actually, the reason behind this is due to the surging levels of progesterone hormone. This hormone is equally important in maintaining pregnancy. And in my case, I actually did that pregnancy test because I was always tired. I don't know why, because I'd already ran other medical tests and I was okay. But I was ever weak, tired, dizzy. At times I would faint. Yeah. So with this, you'll find it on another level. Actually, all pregnancies, there is some level of fatigue. But with twin pregnancy, the fatigue is on extreme levels. You do this, you are already tired. You wake up, you are already tired. You want to go to your duties, you are already tired. On your duties, you are sleepy, just due to the levels that are rising, the progesterone. Another important thing to note is that movement in twin pregnancy always starts earlier than this other singleton pregnancy. In a singleton pregnancy, the movement can start from week 16 onwards. But again, in twin pregnancy, you can start feeling the movements as early as 12, 11, 12, 13 weeks. Yeah. Around 13 weeks, my movement had already been established and I could feel. By 13, 12 weeks, I was already feeling that, okay, that is a baby moving or kicking. And again, with twin pregnancy, you can feel movements on different parts of your tummy at the same time. This will show you that, okay, most likely you have more than one baby in your tummy. Quite important to note is that during twin pregnancy, your belly will grow bigger and heavier than usual. Actually, it will not be corresponding to your gestational age. Yeah, you'll always find, okay, if seen you look like already you are 5 months pregnant but you are only 3 months pregnant, it's normal because you are carrying more than one baby. In my case, by around 12 weeks the belly was already showing, unlike others. And again, each and every individual is different. To some women, they can just carry it smoothly without being known, but what I know is that the heaviness cannot be ignored. In twin pregnancy, the belly is heavy. Actually, it's heavy more than the singleton pregnancy for obvious reasons of carrying more than one baby. And again, the amniotic fluid and the placenta too is big. Another important point to note is that food aversion and food intolerance in twin pregnancy is also on another level. Actually, you will be so choosy. As much as any other pregnancy, there is that food aversion and food intolerance in most of the pregnancy. But again, in twin pregnancy, you will be much choosy with your food. Especially in the first trimester, the food intolerance is much, it's extreme, and so you just have to find a way of taking care of what you eat. Whatever you can retain is what you really want to eat. As much as you remain hydrated, try as much as you can to eat as little or as much as you can. In twin pregnancy, there is exaggerated pregnancy symptoms compared to singleton pregnancy. The level of breast tenderness is on another level. The moodiness, the level that you will be visiting the toilet just to go and pee. My dear, you will be making trips, especially in the first trimester. All this occurs due to the rising levels of HCG and progesterone level just to maintain pregnancy. And remember, in single pregnancy, the levels are not that high. The hormonal levels are not that high compared to the twin pregnancy. So in twin pregnancy, if you experience extreme moodiness, frequent visitation of the toilet, the breast tenderness, the bloating, food aversions, all those pregnancy symptoms are always very much high and exaggerated. And at times you can literally feel sick, and it's normal. That is how twin pregnancy can be. Most mothers of twins have what we call intuition. This is just an instinct feeling that this pregnancy is not just one baby. It happens maybe from the experience that you've had, like maybe if it's your subsequent pregnancy or even if it's your first pregnancy, but that feeling is always there to some mothers. And to me, actually, by around 8 to 10 weeks, I'd already felt like I really doubt if I'm carrying one baby. Maybe from the heaviness that I was experiencing or even the frequent urination. But actually, I had it in mind that maybe this is more than one baby. And by the time I was going to do my ultrasound, I was only going to confirm that I have twins. When the sonographer told me that I had twins, it wasn't much of a surprise because actually it had already been on my mind that most likely this is not just one baby. This is what we call intuition feeling. Actually, as a mother of twin, and if you are having a twin pregnancy, there is more than once, twice, this thing will cross your mind that actually this is not just one baby. Yeah. It's important to note that each and every individual is different, and every mother too is different, and every pregnancy too is different. Twin pregnancy can be carried out smoothly, while others can have problems. And again, on the symptoms that I've just talked about, not every individual must experience these kind of symptoms. Some do not experience them, some do. So the best way to diagnose twins is through an ultrasound in the hospital, or maybe after delivery if at all you didn't go for an ultrasound. That is also quite okay to note that Not all these symptoms must be experienced for you to know that you have twins. Yeah, if at all you have that intuition feeling that you keep on crossing your mind, maybe I'm having twins or not, kindly go and do an ultrasound just to confirm whether you have twins. Bye. Thank you for watching this. Let's meet in my next video.